Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Good morning, Dr. Normington. How are you today?
Good morning, Jordan. Great.
Good. So today I wanted to talk to you about liposuction, which is probably something that a lot of people find common in plastic surgery practices. Can you just explain to me what exactly the procedure is?
Yeah, sure. Generally, liposuction involves making a tiny little incision and then vacuuming away fatty tissue. So to some extent, it's a minimally invasive procedure because there's a tiny little incision and we're able to contour the body below the skin.
Awesome. So does that permanently remove the fat cells then?
Yes. So we are all born with fat cells, and the number of fat cells that we have is really set at puberty, and liposuction goes in and permanently removes those fat cells to permanently change how somebody's proportioned.
Okay. And are there specific areas of the body that can be treated with liposuction?
Really, you could almost treat any area of the body. I think common areas, starting from the top and kind of working our way down. It's very common to treat the chin. We all get a little blob of fatty tissue below our chin, and it's very easy to treat that area. We commonly do that, and that's sometimes we'll combine with other facial procedures like facelift surgery, things like that. And then working the way down, very common to treat the breast, the love handles, the tummy. Also, the thighs are commonly a problem, and we can treat those saddlebags and get folks in those tighter jeans without a problem.
Yeah, so who would you say would be a candidate then for liposuction?
Yeah, good question. So I think the ideal candidate is somebody who's not overweight, not obese, but just has problem areas that don't respond to dieting and exercise. And, I think we all have those problem areas that just seem to never go away. That's the ideal candidate for somebody to have liposuction.
Yeah. And so what sort of anesthesia does this procedure require?
Sure. So sometimes we can use local anesthesia. So if it's, one or two isolated areas, we can easily numb those areas up the same way a dentist might numb up a tooth. We can numb up those areas and then go ahead and do the liposuction. If it's numerous areas or larger areas, generally our practice will do something called the tumescent technique, which involves the injection of a medicated saltwater solution into the area. That saltwater solution does contain local anesthesia. And then typically with that, we'll give some sedation to make the patient comfortable. And the sedation is very similar to what folks might get if they have a colonoscopy, which is a very common procedure. So the patient is sedated, very comfortable, and we go ahead and do the procedure under this tumescent technique.
Okay. So what sort of downtime should patients expect to have?
It depends on how much we do, but generally it's a pretty quick recovery. Usually folks are back working, doing normal activities, in a few days. So like over a long weekend, you could recover. We often have folks wear some sort of compressive garment over the area to compress the area. The compression makes people feel better and reduces swelling and speeds the recovery. And that's the sort of thing people can wear under clothing and go back to work. So it's got a pretty quick recovery in general.
Okay. So how soon should patients see results? I know with swelling and everything, it might not look like there are results.
Yeah, so there is a little bit of swelling. I tell people they're not going to be bigger than they are now, but there will be some swelling from the final result. But most of that swelling is gone in about 4 to 6 weeks. So, pretty quickly you'll see some changes.
Okay.
Yeah.
And is it important for patients to have good skin elasticity, once the fatty tissue is removed?
Yeah, that's a good question. So that's really the key thing. So when you see the doctor, one of the first concern they'll probably have is the quality of the skin over top. We don't want to create loose skin, and that's really the issue. Liposuction doesn't treat the skin. It only treats the fatty tissue underneath. And if there's some loose skin over top, by reducing the volume, it may make that skin look more loose. So the analogy I like to use is our skin's kind of like a party balloon. When you blow a balloon up for a party, it's nice and toned and taut. But a few days later after that party, the air leaks out of the balloon and becomes loose and lax and wrinkly. And our skin is the same way. So one of the concerns the doctor will have, we don't want to create that loose and lax skin. They'll check your skin tone. If the skin tone isn't adequate, we would need to steer you towards a procedure that would tighten the skin as well. So in the tummy, for instance, we might steer you towards a tummy tuck, or in the face area, we might steer you towards some sort of neck lift or a facelift.
Right. Okay. So what would be the average cost, would you say, of liposuction?
Well, it really depends how much you're going to have. So I kind of liken this to body work on your car. When you take your car in for body work after an accident, it really depends, how much body work is necessary. If it's a small little area, it literally could be a few $100s. If it's your total body, it could be in the high thousands, $7,000, $8,000.
Mm-hmm. Yeah. So I've read about different liposuction options that we offer between like Safe Lipo, Smart Lipo. Can you tell me the differences between those?
Sure. So there are different kinds of liposuction. In general, liposuction involves inserting a small cannula and then vacuuming out fat. We commonly use in this practice something called power liposuction, which vacuums away fat, but the little cannula that we insert vibrates. It's vibrating at literally several hundred motions a minute, and the vibration breaks up fatty tissue. So it's very effective at removing fatty tissue. And then the other option that we offer is something called laser liposuction. The brand name we use is something called Smart Liposuction. And Smart Liposuction uses a laser to go in and literally melt away those fat cells. So that's very effective at treating some of those stubborn areas of the body, like the back and the love handle area. The nice thing about the Smart Liposuction option is we are able to actually use the laser and treat the deep layer of the skin, and we can actually accomplish some level of skin tightening. And that's something the doctor can, sort out whether it would be helpful. But it's a way that we can to some extent tighten the skin with liposuction.
Okay. So would you recommend different types of liposuction for different areas of the body?
Yes. Like for instance, this morning I have a liposuction procedure, and she has some little bit of loose skin on the back, kind of under the bra strap. So we're going to treat that area with Smart Liposuction to help tighten up that area so she doesn't have that little bit of a roll there. And then we're going to use Power Liposuction on her love handles to reduce some of that fatty tissue there. So we often incorporate different types of liposuction for different areas for different reasons.
So would there be a difference in recovery or like the time frame of the results with these different forms of liposuction?
Not necessarily. I think they're all about the same.
Okay.
Yeah. It does take a little longer to see the skin tightening aspect of it. That can take 6 months, but usually we'll see results again in a few weeks.
Okay.
Yeah.
Great. Well, thank you.
Sure. Thank you, Jordan.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.